Itu tadi. Share screen. Kalau ni.
It's unable to join in. Yeah, I saw. Maybe let me
Try again.
share his email address here as well.
Try masuk ni tu.
Bunyi pun.
Try masuk. Sarah? Sarah, just try masuk dekat.
Right. What about your presentation? Can you
Yeah.
start first?
Yeah, I can, but I will need to do the same thing. I can't share. Let me try again. Let see I can share my screen.
Kan create channel.
Kat channel. Kenapa kena create channel? Share. Oh, kejap.
Dah ada slide untuk ni.
Kalau ni, kalau try buka yang tu, sekejap satu lagi. Try buka yang ni. Kalau yang tu boleh tak?
Yang cycling tak, video ada juga. Video is private.
Private, okay. So macam mana kita nak?
Tak ada bunyi suara.
Mana kita nak edit balik edit balik kot. Customization. Anyone.
Lah tu? Ada. Siapa yang anu aku ni?
Dia nak update kan.
Cancel message. Oh, this visibility. Private.
Oh, bagi email.
Let anyone at anyone his name. Bagus lah. Kan. Okay, save. Try balik.
Okay dah.
Boleh? Okay.
Cuba tengok first statement dia macam mana. Apa yang mengelirukan. Kemarin risau.
Sarah, try balik.
Dah boleh lah.
Boleh tak? Tak dapat. Yang second.
I've been able to join again. Apologies for that. The meeting wouldn't let me join earlier, saying that the maximum limit has reached.
Belum lah doktor.
But I think, now I'm here now.
Ni.
Apa dia terasa
Boleh? Sekejap aku kena beritahu doktor ni sekejap.
Ya, rasanya.
Yeah, but it's still not letting me share my screen.
Hello doktor. Oh, okay doktor. Oh, tak apa doktor. Apa ni? Tak. Apa tu saya try buat live ni. Saya boleh share screen. Saya share link boleh? Saya try share link dekat dalam apa nama chatbox tu. Kalau let's say diorang okay, then kita proceed macam tu lah doktor. Okay doktor. Okay.
Are you still on the line, Dr. Salme and team?
Kesian doktor Salmi. Tiba-tiba Datuk Yati kacau dia. Betul. Okay, kejap tapi Sarah, kau dengar ke diorang yang dia cakap-cakap ni? Dengar? Dengar suara aku? Tapi ada suara ni dengar tak? Suara yang dia cakap tadi.
Is back online.
Okay.
But yeah, we are still having issues sharing our
Suaraku?
screen.
Okay.
Why I can see your screen now?
Yeah, it's coming up now, I think.
Yeah. This is your slide.
This is Dr. Karan's slide. I have his
this is
slide
right.
with me.
All right. Okay.
Can you all see it? Maybe I go into the presentation mode.
Yes.
All right. Sorry.
Is it all good now?
Is it okay now, everybody?
It's not yet in the presentation mode. Why?
All right.
Yeah.
Kalau okay, aku nak blast dekat diorang.
Okay,
Yep.
can you make it slideshow? This one is not slideshow.
Is it all good in presentation mode?
Not yet.
Not yet.
buka aku punya speaker lah. Aku punya mic. Aku duduk mana lah? Nak kena duduk mana? Bilik. Aku rasa macam ada orang tadi. Sekejap cukup lah.
Sebelum aku bisa lebih jauh lagi. Baik. Sekejap.
Tu internet situ tak ni oh. Dia macam hilang-hilang.
Itu dah over limit ke?
Is it sharing now?
We cannot see the presentation. I think you're sharing your screen. So we can see the meeting again.
Sekejap. Sesi meeting
Boleh tunggu bilik tak?
Sekejap aku call Jason.
Mak besar pula bilikmu. Satu. Masih sambil duduk.
Has it come up?
Not yet.
Why can you share with us and you can put it from here?
Let me also try while this one last time.
All right.
I'm going to share my entire screen, but then I'm going to bring up the presentation to see if it goes into. Is my screen visible?
No.
Is it?
So
Yep,
that's
yep.
it, okay.
It's visible, right?
Visible, yeah.
Okay. So yeah, very good morning once again. Very sorry for those technical issues. I got logged out and I could not log back in, but now I think everything is set. So thank you again for this opportunity to talk a little bit about the COVID-19 medical and scientific update. Just a disclaimer that a lot of this information is dynamic and may keep changing and updating. So my presentation would primarily focus on the current situation of COVID-19 across the world, across Asia, in different countries. And this is mainly based on the World Health Organization COVID situation report. So these reports come on a regular monthly basis. So a lot of the data that you will see in the slides to come is from the WHO report, which was released in mid of January, which is basically the situation of COVID-19 across the world in different parts of the world from December, November 2024. So it's quite a close, recent kind of a picture of how COVID-19 situation is. One of the key points that the World Health Organization and even some of the countries have now started focusing on is the SARS-CoV-2 test positivity, where basically this is the, out of all the specimens that are tested, patients with respiratory infections, how many of these patients are actually testing positive for COVID-19? So we all know that in general, the testing has been much less in the last 1 or 2 years compared to during the pandemic. So the reported cases may not be fully reliable, but nonetheless, looking at this parameter, which is the SARS-CoV-2 test positivity, is a little more reliable because it does not get that affected by the under testing per se, because it is a proportion. So this slide talks about the SARS-CoV-2 positivity data as provided by the World Health Organization report. We can see the positivity across different years from 2021 to 2024. And you can see the positivity represented in the blue line, which was obviously quite high in the beginning of the pandemic. Then there was one more surge in 2022, followed by two more surges, a tall peak in 2023, which came down. And then gradually in 2024, if you follow the blue line, you can see the positivity peak occurred twice in 2024, reaching up to 20% positivity in the early 2024, and then around 15% or less than 15% towards the end of 2024 as well. So what this basically highlights is that COVID still occurs. It is maybe not as common at what it used to be, but the positivity still persists. Now, as I mentioned earlier, the overall testing has been decreased significantly. The reporting is also decreased significantly. Hence, what the clinical cases that we see may not actually represent the community burden of COVID-19. The World Health Organization and many countries, they do something which is called as a wastewater surveillance, where basically they test the wastewater from the sewage for SARS-CoV-2 virus and also do genomic sequencing there. And they see a lot of variation over there in the terms of the high wastewater burden of COVID-19 circulating in different countries. Now, if we compare this with the clinical reported cases or those who test positive, it is about 2 times to 19 times lower in the test reported. So it is higher, much more in the wastewater surveillance. What that means is that for every one case reported, there could be about 15 or 19 cases which may go unreported or undetected in the community level. So that's the extent of the actual burden versus what is being seen and tested positive. Now, if you look at this latest report data from November, December 2024, although the new number of cases decreased by 6%, if you look at this 28-day period towards the end of last year, there were still close to about 200,000 new cases that were reported across the world from the countries that were still reporting to WHO. Not everyone reports to WHO. The number has also gone down significantly. If you look at the new weekly deaths that were reported in this 28-day period, it would decrease by 24%, but the absolute number was still around 2,600 new fatalities that were reported in this period. Now, what about the situation in Asia? So this is again the table from the WHO report, where in the first column you see the different WHO regions. I have highlighted the rows for Western Pacific and Southeast Asia. And then over here, we can see that, for example, if you look at the data for Western Pacific region, we see that the increase in cases in that November-December period was around 6% compared to the previous window. If you look at the number of new deaths, there were 36 new deaths reported in this region, which was around a 6% increase compared to the previous 28-day period. Another point we note over here is that the countries reporting these cases is only a very few out of the overall countries that are a part of the Western Pacific region. And even then, we can see these kind of numbers in trend. Similarly, for Southeast Asia, the number of new cases, there was a decrease by 6% in November, December compared to the previous 28-day period. If you look at the number of deaths, there were 9 new deaths reported, which reflected a close to 30% increase in the death rate compared to the previous 28-day period. What about hospitalizations within Asia, within our region? So again, this is a graph from the World Health Organization report, which shows the picture from November to December 2024, comparing it to the previous 28-day period. In the first column, again, we can see the different WHO regions, and I've highlighted at the last 2 rows for Southeast Asia and Western Pacific. If we zoom in into the extreme right of the table and we look at the percentage change in new hospitalizations, we can see there was a 5% increase in hospitalizations in Southeast Asia that was reported. And there was a 39% increase in hospitalization in Western Pacific that was reported in this November-December period compared to the previous 4 weeks. Now, this kind of picture, this report comes on a monthly basis, so this is a ever-changing picture. In this report, we see an increase in Southeast Asia, Western Pacific, even Africa, but there is a decrease in America and Europe. If you go to some previous reports, you will see you could see a different picture where Europe and Americas have a high rate, Asia may be decreasing, and so on and so forth. So what this kind of tells us is that throughout the year, COVID keeps circulating at different time points. in different countries in different ways, in different peaks, and then it comes down, and then maybe some other country has a peak. And in this open international global world, this certainly affects everyone in a way, although at a certain point, a country may or may not be seeing a peak. The World Health Organization has also been tracking 2 severity indicators to monitor if COVID-19 is getting any severe. Generally, we know that compared to the previous variants, like for example, the Delta variant, the currently circulating variants are not as severe, they are milder for several reasons. So if you look at this particular severity indicator, which is how many ICU admissions were reported per 100,000 hospitalizations. So this is that data from 2020 all the way up to November 2024. So in the gray bar graphs, you can see the actual number of new hospitalizations. So we can see during the early part of the pandemic, the bar graphs, the towers were quite tall, and then the hospitalizations gradually have decreased. The blue line is actually the trend of ICU admissions per 1,000 hospitalizations. So earlier on in the pandemic, obviously, the number of ICU admissions per 1,000 hospitalizations was quite high. It then started decreasing from 2021, 2022. It remained low throughout 2023. But then at the beginning of 2024, there was an increase that was noted in one peak. It came down again, and then another increase in this indicator was seen towards the end of 2024. This does not necessarily indicate that the severity increased. It could reflect some of the discrepancies in things like, there are only a few countries reporting it, so it may not reflect the overall picture. But nonetheless, this is one indicator which WHO continues to track since the beginning of the pandemic, and it continues to do so even now. Now, looking at the different variants, we all know that SARS-CoV-2 has different variants which have evolved over time. So if you look at the current picture, which are the circulating variants, as per the World Health Organization, there is one variant which has been designated as the variant of interest, which is the JN1 variant. There are 6 variants which have been designated as the variants under monitoring. So it's KP2, KP3, KP3.1.1, JN1.18, LB1, and XEC. And then there are the other recombinant variants. Out of these variants, as of now, XEC seems to be the most predominant circulating variant across different parts of the world, including in Asia. Again, over here, as we spoke earlier about the decrease in testing, the amount of genomic sequencing to determine the different variants has also gone down significantly. And there could be a delay in reporting as well. So, we may not have the most updated data from all the countries, but nonetheless, this is what is from the last report towards the end of 2024. I also saw some of the reports from the global influenza surveillance system of WHO very recently, and they kind of show the same trend where XCC seems to be increasing. Fortunately, there is no variant of concern as of now based on the clinical severity and the other parameters that the WHO continues to access. Now, again, this slide shows in different colors how the different SARS-CoV-2 variants have evolved right from 2019 up until Jan 2025. So the different colors represent the different SARS-CoV-2 variants. The one in the pink over here is the XCC variant. What this means is that as the virus evolves, based on how much it evolves, what is the quantity and the quality of mutations in the proteins, in the spike protein especially, it would impact the natural immunity, it would impact the vaccine immunity, and sometimes even the pathogenicity of the variant. And this is one of the reasons why, as the virus evolves, based on this antigenic data and the immunogenicity data for the evolved viruses, the authorities across the world, the WHO, the US CDC, the European Medicines Agencies, and the other countries, they have been recommending an update in the COVID-19 vaccines throughout the years. So after the original vaccine was introduced at the time of the pandemic, the second one was the bivalent, and then the XBB, and then the latest one is the JN1 vaccine that has been recommended. Now, although we know that overall the severity has decreased, it has become much milder with the recent variants compared to the earlier variants like the Delta variant, there are still certain groups of populations which can have severe COVID-19. So as per the data, as per recommendations, which are these high-risk groups for severe COVID-19. Age is one of the biggest risk factors. We'll see some data on this because of immunosenescence, because of other chronic age-related conditions which may affect the immune system and the immune response. People with comorbidities and multimorbidities also tend to have a higher chance of severe COVID-19 infection, again for several reasons. It could be a weaker immunity, a general pro-inflammatory state of the immune system, and so on. It is said that healthcare workers may have a higher risk because of repeated exposure to patients, which may lead to a higher viral load exposure, which may also increase the overall viral exposure time. The data has also reported some ethnic disparities in some groups being more uh, uh, susceptible to severe infections, and also some susceptibility for the male gender for several reasons for more severe infections. Now, if you look at the data on the risk of COVID-19 hospitalization along with different age groups, so this is the data from the US. It is data from March 2020 up until December 2024. So we can see on the vertical axis here is the hospitalization rate, and on the horizontal axis we have the different years, and we can see the different rates of hospitalizations for different age groups represented in different colors. So above 65 is the purple color, and the other extreme of age 0 to 4 year is the light blue color. So we can see one constant factor, that despite the time period, the purple wave is the one which is on the top, which has had the highest number of hospitalizations. After that, we can see the next age group, which is 50 to 64. It is lower, certainly much lower than that, but that comes second. And then at places, we also see the younger age groups, 0 to 4 years, coming in as hospitalization. But especially in the recent years, in the last 1 year or so, it is the 65 years and above age group which kind of stands out in terms of the number of hospitalizations based on this data from the US. Now, in terms of comorbidities, there are several comorbidities that may predispose one to having severe COVID-19. Over here, we can see some information about diabetes. Diabetes, we know, is one of the common non-communicable diseases in Asia, even in Malaysia. Similarly, tuberculosis is also quite common. HIV can also be a public health issue. So what this slide talks about is the bidirectional relationship between diabetes on one side and tuberculosis on the other side, and how they can worsen and contribute to the pathophysiology for each other. And in this scenario of diabetes and tuberculosis, how viral infections like HIV, like COVID-19 can further worsen the situation and make someone more prone to severe complications. I won't go into the details, but just a quick representation of how different diseases can act together and lead to an increase in the healthcare burden. Again, some more data about on concomitant tuberculosis with COVID-19 and the risk of severe outcomes in this population. So this data that we see on this slide over here, it comes from a prospective cohort study from about 34 countries in the time period of March 2020 to June 2021, around 767 patients who had concomitant TB and COVID-19. So obviously at that time, we know in 2020, 2021, it was a different variant. So the severity was much higher at that point in time, which is, so this picture may or may not be true as of now. We don't have the most latest data on this. But nonetheless, if we look at this data from 2020, 2021, in the pie chart, we can see below, there were about close to 50% of these patients who needed to be hospitalized. Around 11% had mortality. Now, within these 11% who died, what were the reasons reported for death? Around 50%, the reason reported was both COVID-19 and tuberculosis. For 37%, it was COVID-19 alone. And if you look at the cause of death of tuberculosis alone, it was in a very small proportion. The risk factors for death were reported to be increasing age, being male, and the patients needing invasive mechanical ventilation. Overall, the authors in the study reported that the hospitalization rates and mortality rates in patients with concomitant COVID-19 and TB were higher than alone. Now, this is some data on patients who had concomitant dengue and COVID-19. They also seem to have severe outcome. Again, this is data from 2021, Jan 2021 to July 2021. So it's a retrospective cohort study from Brazil. Again, at that time, we know the severity was higher, so this may or may not be applicable now. But nonetheless, if you look at what was seen in such patients in 2021, if you look at the table on the left, which is basically the comorbidities that were found to be common in this study. So the top three comorbidities were asthma, cardiomyopathy, diabetes, and then you have the other conditions. Now, out of all these conditions, the one which was statistically significant with a p-value less than 0.05 was highlighted as diabetes. If we look at the table on the right, which shows the clinical and hospital characteristics of these patients with both dengue and COVID positive together, and comparing it to only those who were COVID-19 positive, they reported that those who had both positive had a higher rate of invasive mechanical ventilation, which was statistically significant. They also reported that patients who had secondary dengue and then were infected with SARS-CoV-2, they more frequently presented with symptoms like dyspnea, respiratory distress. They also had longer hospital stay, ICU stays, and a higher mortality rate as well. And hence, the authors highlighted the importance to be able to differentiate between these two diseases, because both can be an issue, especially dengue can be an issue for tropical countries as well. And then having this differentiation can potentially help in better patient management. So, just after that snapshot of a little bit of data, if you look at the recommendations over here, we can see recommendations from Malaysia, which are pretty much aligned with even the other country recommendations, the global recommendations, the WHO recommendations. So these recommendations obviously were released in 2021. And as per these recommendations, the priority groups for COVID-19 vaccinations in Malaysia that were highlighted were number one, the elderly, then people with comorbid disorders like chronic heart disease, vascular disease, chronic kidney disease, liver disease, respiratory illnesses, neurological disease, severe mental illness, and so on. Diabetes was highlighted as a separate risk factor for being a priority group. Obesity, those with immunocompromised conditions, those with asplenia or dysfunctional spleen, and also pregnant persons were highlighted as a priority group. Now, safety obviously is the most important aspect. And then just to show a little bit of real world safety data on particularly on the mRNA COVID-19 vaccines. So in July 2023, the International Coalitions of Medicines Regulatory Authorities, they actually issued a statement regarding the safety of COVID-19 vaccines. Now, this agency, the ICMRA, as it's called in short, it's a group of different country regulatory authorities sitting together. It's a committee of different country authorities, and it also has WHO as an overseer and observer. So what did this committee say? They mentioned that there is evidence of safety based on more than 13 billion doses of COVID-19 vaccine given worldwide, which includes more than 100 million doses of mRNA vaccines per se. We know that there were different types of vaccines, right? There were mRNA vaccines, there were the inactivated vaccines, adenoviral vector vaccines, and so on. So out of these more than 13 billion doses, it included hundreds of millions of mRNA vaccine doses worldwide. If you look at the data from Malaysia, based on some of the reports from NPRA, in Malaysia, it is estimated around a little more than 45 million doses of mRNA vaccines were administered up until the end of 2023. And the inactivated vaccine was around 21.5 million doses, and then the others were lower than that. Now, coming back to this statement from ICMRA, overall, the committee said that the safety profile across age groups has been found to be very good, and the benefits of the vaccines far outweigh the possible risks. The committee also mentioned that based on the available data, vast majority of side effects observed were mild and temporary. There were some serious side effects, but they were very rare, which is reported in less than 1 in 10,000 population. Even in the special populations, there is data available, including patients with comorbid conditions, immunocompromised conditions, pregnant women and children. And the safety profile in this population is similar to what we have seen in the general population of what this committee saw as per the data reviewed by them. The committee also commented that the long-term safety data has been reassuring, which includes data from not only the large clinical trials for more than tens of thousands of volunteers, but also data from the mass vaccination campaigns lasting more than 2 years across multiple countries. I mentioned the NPRA report earlier. I don't have a slide on it, but if we look at the national report published in Malaysia by the NPRA as of December 2023, that was the last report I could find. So it's a very similar safety profile where in adults, more than about 93% of the adverse events were non-serious, mild, self-resolving. 7% of the adverse events were marked as serious, and these were all adverse events following immunization. So the causality assessment may or may not have been related to the vaccination, so because all these events had to be reported. Now, if you look at the, out of 40, if you look at just the mRNA vaccines, the 45 million doses administered and how many serious adverse events were reported, and we try and calculate what is the rate of serious adverse events for the mRNA vaccines as per the NPRA report. It comes to around 0.0026%, or around 2.6 cases of serious adverse events reported per 100,000 population, or 100,000 vaccines administered. So it's quite consistent with this global data as well. What does the World Health Organization talk about safety of vaccines? So, again, I won't go into the detail, but it just highlights, if you go on the WHO page, around the process, how the vaccines were required to meet rigorous testing requirements in the clinical trials, and the internationally agreed benchmarks for safety and efficacy. And these were reviewed by the authorities, including the WHO and the national regulatory authorities, before they validated these vaccines and before they authorized these vaccines. They also mentioned that these authorities continue to monitor the COVID-19 vaccine data, in addition to the safety issues that may arise. So this is something that they keep a watch on. And they mentioned that the serious reactions are also extremely rare as per the previous data. Now, myocarditis has been something which has been discussed as well, especially with regards to mRNA vaccination. So over here, there is some data which talks about how myocarditis differs in different situations. So in the first column, we have viral myocarditis because of non-COVID related viruses. Then we have myocarditis due to COVID-19 disease itself, and then the data on myocarditis reported after COVID-19 mRNA vaccination. So if you look at non-COVID viral myocarditis, the incidence reported is around 1 to 10 per 100,000 people per year. This incidence goes up significantly with COVID-19 disease, about 1,000 to 4,000 per 100,000 people. Now, the rate reported for mRNA vaccines is around 0.3 to 5 per 100,000 population per year. Again, if you look at the NPRA report for Malaysia, in the 2023 report, they mentioned that there was no case of myocarditis reported from end of 2022 to end of 2023. If you look at the 2022 report, which was published in December 2022 by the NPRA, the rate of myocarditis reported with the mRNA vaccines in Malaysia was 0.16. So much lower than this, 0.16 per 100,000 population per year. Now, overall, coming to this slide, if you look at the survival rate, it's more than 80% in non-COVID viral myocarditis, around 30 to 80% in COVID-related myocarditis, and more than 99% in COVID-19 mRNA vaccination associated myocarditis. So typically, this event, which is very rare, reported mainly in adolescent males, tends to be mild and then self-resolving as well, so which is reflected in this very high survival. Now, the potential mechanisms around the pathophysiology on the non-COVID viral myocarditis, there is an element of myocardial injury that is involved. For the COVID disease-associated myocarditis, again, we see there is endothelial injury, microthrombosis, sepsis, and shock. The potential mechanisms for myocarditis following COVID-19 mRNA vaccination, tends to have a genetic basis. There could be some immune cross-reactivity, gender-related factors, and it could be a hypersensitivity reaction as well. So just to summarize, in my last slide, again, a statement from the most recent statement from the World Health Organization, where it highlights that COVID remains a public health threat, and the member countries should continue to maintain the infrastructure that they had built. If you look at the overall picture from the beginning up until the end of December, globally around 777 million confirmed cases with around 7 million deaths have been reported. And it's not just the acute burden. The WHO also highlights the post-COVID-19 condition, or also known as long COVID, which can also continue to be a potential substantial burden on health systems. It's very difficult to precisely estimate, in what percentage it occurs and what is the actual burden. But there is data, different kinds of data, and what WHO reports is that approximately 6% of people who have a symptomatic COVID infection may end up with PCC. We also know from previous real-world data that those who have a more severe COVID-19 infection could be at a much higher risk for COVID-19. But nonetheless, just because of the number of mild infections, that so much, and also the reinfection, WHO says that more than 90% of actually these post-COVID conditions can occur in the so-called mild COVID-19 as well. And there is data which may show that vaccination may have a protective effect over here. Hence, overall, what the WHO says, it's crucial to have early warning systems, surveillance, reporting, variant tracking, provision of prevention via various methods, including vaccination for high-risk groups, early clinical care, improvements in ventilation, and the most important is regular communication with the stakeholders. So that is it. I will stop sharing and then we can take up any questions if there are any.
Thank you, Dr. Karen. Since Dr. Karen should to leave early, we will proceed direct with the question and answer. If any, you raise your hand or just throw out the question. Ada tak? Ada tak tengok dekat iklan? Is there any question from the floor? Okay, raise your hand. All right.
I can see some questions in the chat. I think there is a question on, is there any data to mention COVID-19 vaccination can provide protection for how long? So yes, there is certainly a lot of real-world data across the different countries, across different types of vaccines that have been there. So in general, they say that the duration of protection for severe outcomes like death, hospitalizations, severe COVID-19 tends to be more longer, more sustained compared to duration of protection for mild infections. Now, how much is this typically? They say for, and again, this depends on how the virus also evolves, right? So it's the vaccine and the virus. So as we have seen in the last years, duration of protections for severe outcome could last starting, at a high level from 3-4 months after vaccination to about 5-6 months as well. And then gradually we see waning. These less severe outcomes may wane faster. But what the World Health Organization says is at least for the 3-4 months after vaccination, we see a high level. And then it gradually, so for example, if the, say after vaccination 3-4 months, the effectiveness could be around 60-70% for the severe outcomes. And then this would gradually decrease over the next 5-6 months. That is why, based on this kind of real world data, the recommendation is to vaccinate at least once a year whenever there is an updated vaccine so far. And then for high-risk groups who are like the immunocompromised or the very elderly, there are some countries which say that they may get, after the vaccine, if the 6 months have passed, they may get another dose. So it's kind of twice a year. So that kind of gives us an idea that, yeah, this is, 1 year in general, and then at least 6 months for the very high risk or the immunocompromised.
Okay, thank you, Dr. Karen. Is there any questions?
Yeah.
Any other question?
Whether Omicron XBB can be administered concomitantly with the influenza vaccine. So yeah, if you look at the XBB label currently approved in Malaysia, this is not as per the label, so we don't mention that it can be administered along with that. But the official label in Malaysia also allows that, it also mentions that the final recommendation or the rollout of vaccine use guidance has to be as per the local official recommendations. So I think it will be based on the recommendations that come out in Malaysia as to whether it is accepted or not. But in the label, this is not a part. There are other countries which do it, which allow co-administration. And if you look at, say, other vaccine labels, the latest ones, they do have this. But in the current one, it is not there.
Okay, next question. Baca kan? Baca.
Informative presentation based on the data you have presented. Is there still a need for monitoring post-vaccination for COVID?
Yeah, I think this question refers to when one goes to a clinic, gets a vaccine, and then how long to monitor them in the clinic for any reactions. So I think obviously there were requirements that were, when the vaccines were new, there were some requirements which countries had. This again depends on the local official recommendation. So I think, it depends on what Malaysian experts recommend here. So the label does not necessarily go into the details of this. But if I can share experience from some other countries, like for example in Singapore, they have made this requirement much milder. So it is not as much of monitoring as was with earlier on, because more and more data is available. So there are some changes. Some of the countries have made it a little more relaxed in terms of post-vaccination observation. But yeah, I mean, I unfortunately cannot give an answer. It depends on the local recommendations.
Yeah. Next question.
How many COVID vaccine available for so far? Already vaccinated dua kali, booster dua kali. Is there a need for booster kali ketiga?
Third booster.
Third booster.
Yeah. So far, we have had, during the pandemic, it was the original vaccine, which was based on the original variant or the wild type variant, which was circulating at that time. Then as the virus changed, virus evolved to the Omicron variant, the authorities, and the Omicron was different from this original strain in terms of the antigenic properties. So the authorities said that there is a need to update the vaccine. So then came the bivalent vaccine, which had BA.4/5, vaccine. Then, after Omicron, we saw that graph, right? There were different variants at different times. So after this, XBB variant started becoming more common, which was again antigenically different from the BA.4/5 variants. So that was the time when the authority said, we need to update to XBB. So that is what we did. We followed the guidance from the authorities. We updated to XBB. Then came the JN1 vaccine, again because of this change in the antigenic properties. And at the time when JN1 came, WHO said JN1, US said JN1 initially, and then they changed to KP2 variant-based vaccine. So US vaccines are different, the rest of the world is different. And yeah, it depends on every country to then look at their own, situation, or at least the regional situation, and look at that. As per the WHO, they still recommend the one that they did earlier, which is the JN1. And yeah, they do also say that countries, although this is recommended to have that, but countries should not delay vaccination just waiting for an updated vaccine, because as per WHO, some vaccination is better than delaying or avoiding this. So that's the general situation with those number of vaccines. Now, in terms of your second part of your question, if someone has already received multiple boosters, right? Yeah. So there is data which shows that because this virus, it changes so much, right? People who have had a previous natural infection with a previous variant may no longer be able to cross protect against the new variant. And this is same for vaccines as well. And that is why, a lot of experts are not looking at this as boosters, but looking at this mainly like, an annual vaccination. As the virus evolves, we update the vaccine, and then, so it's not primarily like a booster. It sounds like that, but it's more like, how in influenza, as every year there is a recommendation and then the vaccines are rolled out. So it is kind of similar to that. So yes, there is data that there is certain benefit, especially for these high-risk groups, to get their annual vaccines as recommended by WHO. There is certainly data supporting that.
Okay. Ada lagi question?
Can we give COVID vaccine together with meningococcal and influenza?
Again, we don't have this in the approved label in Malaysia, so this would have to depend on the local recommendations and the local guidelines.
Okay.
How about those who develop adverse effect with the vaccine brand? They say for another dose for the same brand, right?
Yeah, generally, if you look at the approved label, if someone has had a severe reaction with one vaccine, generally they don't, it becomes like something to avoid or be careful for the next dose. So because they could have, if it's an anaphylactic reaction or a severe reaction earlier, then there could be chances with that same vaccine. So yeah, as per the label, that could be a contraindication if the previous reaction was severe, or at least a precaution that doctors should be careful about.
Okay, all right. I think we already over time. So, thanks to Dr. Karen for your updates on medical, on COVID and COVID-19. And I think after this, we just continue with another presentation from Pfizer. Okay, and it's from Mr. Y. Ho, country brand level Pfizer. So Mr. Y will enlightening us on the product updates. about product overview, storage and transfer preparation, also administration of the vaccine. So I think over to you, Mr. Wan.
Yeah, thank you, Dr. Samia. I hope all of you can hear me and can see my screen.
Not yet.
Again, thanks, Dr. Karen. If you want to leave, it's okay.
Sure. Thank you so much.
Thank you for the
time. Bye.
Yeah. Again, selamat pagi and salam sejahtera, everybody. Again, just want to confirm if you are able to hear me and see my screen.
We can hear you, but the screen is not, I think it's not ready.
Yeah. Give me a minute.
Kita ada kan?
Yeah, is the screen up?
Yes.
All right. Good morning, everyone, and my apology for the technical issue again on the early of the session. I'm Y, just call me Y. I'm currently the country brand lead for Comirnaty from Pfizer Malaysia. I've actually put up my number and my mobile number and my email contact here. So again, anybody from the PPV that need any support, specifically on the product, you can reach out to me. I'll be the contact person from Pfizer. Again, if there are more technical, medical sort of questions, I will bring it back to Dr. Karen and we will surely come back to you. So I'll quickly jump into the session that I'll be sharing with everybody today. The objective is very straightforward. We want to ensure that all the Pusat Pemberian vaccine, the vaccination centers provider will be able to, again, all the vaccines actually have been delivered last week to all the 19 POUs. So I believe there are some of you actually have the vaccines ready in the current hospital in the freezer now. But of course, the intention of this training is more towards how to manage and how to administer this vaccine. And I believe many of you may still have the experience from the pandemic time, giving Comirnaty to the Malaysians, and some of you actually may be new. So that's why it's important for us to go through it. And this is really timely because, again, just I look back exactly almost 4 years ago, the Comirnaty vaccine was being deployed in Malaysia in the year of 2022. So 4 years later, we have a new formulation coming over. And the agenda is actually what you can see on the screen. I'll be going through briefly on the product itself.
Sorry, Dr. Y, can you put it in slide presentation? The slides are not moving.
You hold on, yeah. Can you see the slide moving now?
No, unfortunately, it's not.
Is it moving now?
No, doctor.
Is it up again?
No, it's a blank screen.
Yeah.
Can we help you from here? We try to get to present it to you.
Yeah, I think if you have my slide, I've sent it over to you.
Yeah.
Because then you can, I think, easier to share.
Saya screen, tapi saya screen. Saya screen. Saya screen. Dapat tak?
Tak nampak orang.
Yep, that's good. Again, my apology. I was also struggling. I did a round of training. I believe some of you were around last week with mainly the 19 POUs on the receiving side, and I was struggling with the slides as well. Really, really sorry about this. Yeah, somehow when you click on the presentation mode, then all right. Okay, terima kasih. Yep, so I was sharing on this slide itself when it wasn't really moving. So it's, as you can see on the left-hand side, the objective is really, we hope to provide all the necessary information, especially related to the community Omicron XBB 1.5 30 mcg itself. And these are a brief agenda. I will run through the product overview, the storage-wise, all the POU, and as well as the PPV, the PSV and the PPV, how to transfer it, and finally, preparation and administration. Yep. Next slide, please. So let's quickly go into the product overview. So this is what we have currently in all your freezers. We have the Comirnaty XBB 1.5 for dispersion for injection. As of now, the stock that we have is actually the 30 microgram per dose. Is indicated for the prevention of COVID-19 caused by SARS-CoV-2 in individuals 12 years of age and older. So what you have currently, the 30 mcg is only for adult, not for those below 12 years old. Currently, we are still in discussion with Ministry of Health to see if there's a need to bring in the other formulation for the below 12 years old. So what you have and what we are going to go through today is mainly on the 12 years of age and older. I've actually attached a PDF document here. You can click on it. This is still the label for the XBB 1.5, because if you go into Quest 3 on NPRA, you'll be able to only find the JN1 adult label on it, because we have just gotten the JN1 approved a couple of weeks ago while the shipment is coming in. So that actually has replaced the XBB label on the NPRA side. But we still have the XBB label that I've attached here that everybody can refer to if needed. So this is how the product looks like. It has a change of color for those who have experienced using Comirnaty 4 years ago during the pandemic. It was purple color for the adult. Now it has been changed to gray color. So you can see the same color for the box as well as the vial. And the box is actually much smaller now. Instead of that, again, some of you may still remember the so-called pizza tray that can put 195 vials. It has been changed to a carton box that is actually on putting 10 vials per pack. So it's similar to the orange cap for those who have experienced orange cap intended for children between 5 to 11 years old. So it's actually a 10 vials per carton box. And this is how the vial looks like, gray in color. It's still a multi-dose vials, just to remind everybody. So each vial actually contains 6 doses. And one of the change this time around, I think this is the first point I want to reiterate, and I hope everybody can remember this point, is that the formulation actually have changed. Is no longer dilution is no longer needed. So this is a ready-to-use formulation. You no longer need to dilute it with sodium chloride like what you did previously with the bubble cap. So this is much more convenient now. And of course, dosing-wise, is still one dose is at 0.3 milliliters, and it contains 30 microgram of the new Rex tocilizumab. So the purple cap is actually with tocilizumab, and the XBB formulation is called Rex tocilizumab. And what is Rex tocilizumab? You can see the definition down there. It's actually the mRNA that produced the spike protein of the Omicron XBB 1.5. Yep. Next slide. So this is a quick overview on what are the main differences between the purple cap, the XBB, Omicron XBB formulation versus the original wild type purple cap. Like you can see, I want to point out in terms of dilution, again, remind everybody again, no dilution is needed. So you can just pour it, and then it will be ready to be taken out and be injected into your patient. So you no longer need any diluent to prepare Comirnaty now for your patient. But similar to the previous one, it's still 6 doses per vial, and the vial size is actually exactly the same at 2 milliliter. Shelf life wise is slightly shorter now. It's actually 18 months shelf life rather than the 24 months that we had with the purple cap. Reason being is because, as Dr. Karen has mentioned, WHO sort of has been picking up the virus SARS-CoV-2 continue to mutate, and almost yearly there's a new variant. So there's no point to keep a long shelf life XBB when next year, in fact now I would say XJN1 is already approved in Malaysia. So the next shipment, if it's coming into Malaysia, it will be the JN1 formulation and no longer the XBB. So shelf life wise, it may no longer be that important to have a longer shelf life for the vaccine itself. And another thing to point out here, for this new formulation as well, do not store it in the freezer, which is at -25 or -15 degrees Celsius. So there's only 2 places that you can store this vaccine, either at the ULT freezer that you have currently where they're all put inside, or if you're taking it out and put it in the refrigeration storage temperature 2 to 8 degrees Celsius, you can actually put it for 2 weeks. So I've actually highlight later again what you should do once you have taken it out from the ULT freezer and put it in the fridge at 2 to 8 degrees Celsius. And of course, after first puncture, once you have punctured it, you have to use it within 12 hours. After that, you have to discard it. Yeah, next slide. Yep. So this is actually how the vaccine should be administered. I believe there's one question, and Dr. Karen actually have addressed it in terms of, if the patient have gotten 2 primary series and then 2 booster, is it still needed to have another round of vaccination with the COVID-19 vaccine? So you can see that based on the current label, approved local label for XBB, we are no longer using the term booster. So, but it's more towards additional dose. So recommendation is still for those who have not gotten any COVID-19 vaccine before. The recommendation is still have to do 2 doses to complete the primary series. But for anybody after that, regardless whether you have gotten the first booster, second booster, you can actually get an additional dose of Comirnaty as long as the last dose that we had actually was 6 months or longer before that dose that we are going to take now. So again, as long as I think most Malaysians actually have gotten the second booster in the year of 2020 and 2022 or early 2023 itself, it's almost 2 years. So majority of us, unless have traveled to other country to get the vaccine, but majority of the Malaysians actually the last booster dose that we had is actually more than 2 years. So yeah, it's very timely, and we can actually give it to the individual as long as it's more than 6 months from the previous dose. But of course, locally, I think for those individuals who are severely immunocompromised, and if they are aged 12 years and older, additional dose, a third dose actually can be given as the primary series. So Normal individuals, 2 doses to complete the primary series, but for those who are severely immunocompromised, 3 doses primary series can be considered. And the third dose actually can be given at least 28 days after the second dose. All right, next slide. Yep, and in terms of the administration method, so like I said, it's ready to use, and it's still the same. Comirnaty will be administered intramuscularly. And again, I want to highlight that do not dilute it, so no dilution is needed. I hope all of you can remember this. And another key point is, because the vial is still the same and the doses are still the same, so in order for you to extract 6 doses from a single vial, you must use the low depth volume syringes and needles. If you're using the normal syringe, you may not be able to get 6 doses out. So to ensure that you can safely draw 6 doses out, ensure that you have the low depth volume syringes with you. Yeah, next slide. Yep, and storage. This is the 2 places that you can install this Omicron XBB vaccine. As I said, the vaccine should not, don't put it into the standard freezer at -25 to -15 degrees Celsius. The 2 recommended storage is actually at ultra low temperature, -90 to -60, as well as the refrigerator temperature at 2 to 8 degrees Celsius. So what's the difference? As long as you're putting it in the ULT freezer, you can store it up to 18 months. But of course, the batch that currently we all have in Malaysia will expire in October this year. So it's lesser than 18 months. Of course, we have been in discussion with Ministry of Health for quite a long time, and the stock has actually been reserved for Malaysia. That's why what you have now is going to expire in October. It's lesser than 18 months. But if once you take it out from the ULT freezer and you put it into the 2 to 8 degrees Celsius, where many of the PPV, they don't have the freezer with them, they only have a fridge. Once it has actually been transferred to the fridge at 2 to 8 degrees Celsius, it can be stored up for 10 weeks. So this is very important, because I believe we will need all the support from the pharmacies at the POU, at the Pusat Simpanan vaccine. When the vaccine is actually being taken out from the freezer and is intended to be transferred to a PPV there, where they will be storing at a fridge temperature at 2 to 8 degrees Celsius, ensure that you mark out the 18 months, the expiry date on that vial itself, and update it with a 10 weeks new timeline. So let's say, for example, if you're taking it out tomorrow, then you should count 10 weeks from tomorrow. That will be the new expiry date of the vaccine. You should not follow the October expiry date itself. Yeah, I hope this is clear. And once you have taken out to 2 to 8 degrees Celsius, you cannot, once it has been thawed, you cannot, the vaccine cannot be refrozen in the ULT freezer. All right, next slide. Yep, and of course, these are some general considerations for storage. I believe many of you have experience dealing with frozen items. So really first of all, during storage itself, minimize exposure to room light and avoid exposure to direct sunlight or UV light to the vials itself if you're taking it out. And ensure that all the cartons are upright in the storage position. And then if you don't need to use it, make sure that all the vials actually stay in the cartons itself and in the ULT freezers. And ensure you take all the necessary care, because these are ultra low temperature kind of environment. Do not touch the vials with your bare hand. Always wear the protective gloves that allow manual dexterity. Yeah, and in terms of transferring at the same time, always remember to wear your gloves before actually you transfer the vials. And when you're removing the vials from the carton, it's always recommended that keep the carton in the frozen environment. So when you're doing transfer, like for example, those Pusat Simpanan vaccine, if you know that you need to take some of the vials out, try to keep the carton in the ULT itself while transferring the vials to a secondary container. But in case if you really need to take the cartons out from the freezer, from ULT freezer, the cartons actually can be out on the room temperature. Of course, when I mention room temperature is below 25 degrees Celsius, you can take it out in a short duration of 5 minutes. So within 5 minutes, you can take the vials out to where it's needed and put it in 2 to 8 degrees Celsius, and the rest of the cartons actually can quickly transfer it back to the ULT freezer. So remember this 5 minutes time frame if you really need to make any sort of transfer from the ULT freezer to the fridge temperature. Yeah, and of course, do not refreeze the tall vials. That is always important. Next slide. Yeah, so this is again just a recap on the option how you can store it 2 to 8 degrees Celsius. Remember that once you put it up, the shelf life actually will change from the printed shelf life on the vials to a 10 weeks new expiry date. So it's very, very crucial that it's the new expiry date of this 10 weeks time frame is being updated either on the vial itself or on the carton or with a sticker to ensure that the final users actually are well aware of this. Next slide. Yeah, and in terms of preparation, again, this is what I have mentioned as well. It's important to ensure that everybody use the low depth volume, the LDV syringes, needles, to draw the vaccine out. Again, because if you are using a standard syringe, you may not be able to get 6 doses out. And the LDV and needle combination should have a depth volume of no more than 35 microliters. Yeah, so this is again a gentle reminder to all the PPV. I believe many of you actually are busy giving out vaccines, not just on COVID-19, but of course, if there are some other vaccines that you are dispensing, this is a standard protocol that you will need to have your alcohol swabs ready, your gloves. PPE may not be relevant for now, but again, it depends on the situations. And also, because we know that we are going to draw 6 doses out, it's good to have, whether you have 6 patients coming in or not, it's good to have 6 syringes and needles ready so that you don't need to search for the needles when you really need it once the vial is actually being punctured. Yeah, and really before you give it to the patient, when you take the vaccine out, again, I believe it's a good practice to ensure that you verify the vial what you're looking at is actually the Omicron XBB 1.5 30 micrograms. I think there's less confusion here because there's only one formulation that we have currently in Malaysia. We don't have the 5 to 11 years old, so this actually can be, the confusion can be totally eliminated. But I think that it's still a good practice for everybody that when you want to give anything to your patient, do a verification, a double check to ensure that what you're giving to them is what you intend to give. Next slide. Yeah, and of course, in terms of preparation also, you need to thaw because the frozen vial it's actually frozen, so you cannot draw it out immediately. So how long does it take? For a pack of 10 vials, if again, regardless whether you are taking the whole cartons of 10 vials or individual vial, 1 vial itself, if you're putting it in the fridge temperature of 2 to 8 degrees Celsius, make sure that you allow the vaccine to thaw for at least 6 hours. Yeah, so give the 6-hour preparation before you use it. So 6 or more, that's better. And of course, once it's actually at the 2 to 8 degrees Celsius, like I highlighted earlier, it's important to update the expiry date. Again, I can't reiterate this, more important to really minimize the confusion because if you didn't write it down initially, you may have lost track of when it was taken out, and then it's very difficult to count back the 10 weeks. So it's really, really crucial to update that. But alternatively, if you don't have the 6 hours to thaw in the 2 to 8 degrees Celsius, you can actually thaw individual frozen vials directly after when you take it out from the ULT freezer. You can thaw it for 30 minutes at room temperature up to 30 degrees Celsius. Yeah, so let's say if you really need to use it fast and you don't have the 6 hours to wait from the ULT environment, you can actually thaw it just by within 30 minutes or longer. That's even better at 30 degrees Celsius. So that will ensure that the content itself is fully thawed. And of course, prior to use, any unopened vial, if you have actually taken the vial out and put it at room temperature, like for example, in this incidence, you want to thaw it at room temperature for 30 minutes. And after that, if you have not opened it, it can actually be stored for 12 hours. Yeah, so at room temperature, so you can still safely use it for the day itself. Let's say if something at 8 a.m. until the 8 p.m., that vials at room temperature is still stable and you can still use it, but not the day after. Yep, and for many that here that will be, helping to administer the vaccines, especially to the Jemaah Hajis that will be coming forward. These are some preparation instruction that you need to do. Once the vaccine is actually thawed, mix it gently. You don't need to shake it, but just inverting it 10 times. Yeah, so you don't need to shake it violently, but just turning it upside down for 10 times. And before you mix it, the thaw dispersion actually may contain white to off-white opaque amorphous particles. So you may see some particle at the bottom of the vial itself. But after mixing it, by right, you should be able to see a white to off-white dispersion, with no particles visible. So this is very crucial. And do not use a vaccine if the particles or their discoloration, instead of white or off-white, you see yellowish, then there could be some issues. So do not use the vaccine, and you can actually report it to us as well. But yeah, I just want to highlight that the mixture itself, after mixing, it won't be like a transparent kind of fluid, but it's actually white to off-white in terms of the color itself. Yeah, and of course, and the final step of preparing it to be administered to the patient, remember that use the aseptic technique. Yeah, cleanse the vial stopper with a single-use antiseptic swab. This is important. And draw out, look carefully. You only need to draw 0.3 ml of the community vaccine from the vial itself. Again, it's crucial. It's only 0.3 milliliters. Anything more than that, you may not be able to get 6 doses out. Yeah, and of course, again, a gentle reminder: the LDV syringe is actually needed. And once punctured, you have to discard. If you are not able to finish it, then it has to be discarded after 12 hours. Yeah, I think that's my last slide. And yeah, this is again, I believe, standard practice. Ministry of Health actually have the guidelines on how to discard, dispose all the vaccine vials and packaging. I think this is important to follow the recommendation under Ministry of Health, because again, this happened a lot during the pandemic time, where people are taking the empty vials and even the carton box. And as you can see on the right hand side, that people are selling this online, which is again a violation of laws. So ensure that all the whatever that have been used, either the vials, the syringe, the cartons itself, are being disposed properly. Yep. So that's my last slide. Yeah, I'll open up the floor for any questions.
Thank you, Mr. Y, for updating us on community COVID-19 vaccine. This is a very important topic for us to ensure that the vaccine we delivered is a very important one. And I open the floor to 1 or 2 questions.
Ada yang boleh register tak dengan vaksin lain? Influenza, ACWY atau pneumococcus?
Yeah, so this has been answered by Dr. Karan previously. On the current label for XBB, there's no recommendation in terms of whether the COVID-19 vaccine can be given concomitantly with other vaccines. Yeah, not for the XBB vaccine. But of course, if you look into again what we have gotten registered, the latest one for JN1 that has been just approved in Malaysia by NPRA a couple of weeks ago. For the JN1 for Malaysian, the updated data where it shows that it can be given concomitantly with influenza vaccine.
Okay, next question.
Do we need to give COVID vaccine card to patient?
Vaccine card.
Yeah, I believe that depends on the Ministry of Health guidance. I understand patient will need to go through my Sejahtera
Yeah.
for this, so I am not sure whether the vaccine card is still needed.
Is Omicron available in private sector?
Yeah, we are not, so from Pfizer, we are not selling the vaccine to any private sector. So the vaccine is still being supplied directly to Ministry of Health, and it's actually up to Ministry of Health to decide who actually can have the vaccine. But I do understand currently it's all MOH facilities that will be giving out the vaccine instead of the private sector. So yeah, in short, there's no Omicron XBB Comirnaty vaccine available in the private sector, as far as I understand. Yeah. So for Jemaah Haji, cukup one dose or dua dose. So it really depends. For those, if you have record that that particular individual has not gotten any COVID-19 vaccine before, which I believe is very unlikely. But we know that there are 85% of Malaysians have gotten there's still 15% of Malaysians that have not gotten the primary series. So if they have not, then you will need to give them 2 doses as per the recommendation, 3 weeks apart, as to complete the primary series. But for those who have gotten the primary series, and maybe some booster years ago in 2022 and 2023, then 1 dose is enough. If the vials is thawed and not punctured, how long is the expiry validity? Is it thawed in 2 to 8 degrees Celsius or at room temperature? If it's thawed within a 2 to 8 degrees Celsius environment, you can keep it for the 10 weeks that I have shared. But if you actually thaw it at room temperature below 30 degrees Celsius and you're not using it, then it will only be valid for 12 hours. As long as once you have taken it out from the fridge of 2 to 8 degrees Celsius at room temperature, the vaccine actually can only last 12 hours. Yeah, and there's 2 questions from MOH Negeri Sembilan. If the vaccine already syringed out, is it stable for 12 hours as well inside the syringe? Yeah, it's not recommended. The recommendation is you will only take it out with the syringe when the patient is ready to get the infection. I know it's actually convenient, right? Once you puncture it, there's